present this information without sharing the really cool stuff we learned about skiing while researching the topic for our course. Researchers often are measuring the physics of skiers, often competitive, but also recreational, both in the lab and on the slopes. Competitive athletes and coaches have a lot to gain from studying this information, an improvement in racing times or trick form, as well as decreased risk for injury. Researchers use all kinds of technology to study skiers: multi-angle cameras, sensors, muscle activity measuring devices. Some of the things we learned about physics in the human body while skiing include: there can be up to 2 times a skier's body weight going through the outer foot of the turn. On the inner foot, it's about 0.2 times the body weight. The knee joint has forces as large as 1.7 times the skier's body weight and also has large flexion angles in both of the knees, with the inside knee averaging 94 to 95 degrees and the outside knee averaging 104 to 135 degrees, with the angle increasing with slope pitch. The spine can have forces up to 2.89 times the skier's body weight at the peak of the turn when the spine position is the most extreme. We know that loading of the spine while in this flexed, side bent, and rotated position is known to create high pressures on the discs. It is important to understand muscle activation during skiing in order to understand how to decrease muscular fatigue that might cause injury. The core and hip musculature are active with skiing. Weakness of the core leads to compensation, poor mechanics, and decreased ability to react to external forces. The most active muscles in skiing are the quadriceps, which is the large 4 muscle group at the front of the thigh, and the hamstrings, which is the large 2 muscle group at the back of the thigh, with prolonged, strong, and repeated eccentric leg contractions. The quads contract at 100 to 207% of the maximal voluntary contraction during turns. Hamstrings co-contract with the quads and are an important knee stabilizer and must be strong, or else we're putting ourselves at higher risk of injury. Research has found that skiers change their mechanics to continue skiing when fatigued. After 3 hours, the quads and the hamstrings are less active. The carving turns transition to a more skidding or parallel turn, and a 45-minute lunch break does not improve the primary ski muscle activation. So even if you feel like you're more rested after a short break, your muscles are still fatigued and your ski technique still suffers. As far as aerobic effects of skiing, one study compared the cardiopulmonary effects of cross-country skiing, indoor cycling, and alpine skiing, and found that alpine skiing is the most fatiguing on the lower extremity musculature and can be as good of a cardiopulmonary exercise if completed with short, fast turns at a high intensity, on average 2.5 times longer due to the lift rides. Another neat study out of Europe looked at elderly skiers before and after a ski season, where they skied 2 to 3 days per week, and they had a positive impact on cardiopulmonary fitness, in part due to the improved breathing economy.